every time you get adjusted, it also boosts your immune 200%. So when I have a lot of patients who people around them are getting sick, they're either not getting, you know, sick, or if they do have like a health issue, they heal and repair a lot quicker. So when you boost your immune, it helps the allergies as well, it helps the histamine levels in your body so that your body can overcome that. So the shoulders go forward. Well, then what happens with that is then you have this tremendous amount of weight. So it's like 32 pounds. And so then what happens is the pelvis rocks forward because now it's trying to help this whole situation here. So now this goes forward, shoulders go forward, and then the pelvis rocks forward. So our goal is to get this curve back, get the shoulders back, and get everything in one plane line.
Welcome back to the show, folks. Episode number 124 with yours truly, Dr. Roxane Zamora is back with us. If you missed our last one, I would highly recommend checking out episode number 114 there on the Healthy Habit Podcast, where we talked chiropractic care, allergies, and mental health. And Dr. Zamora even highlighted Drenamin, a product by Standard Process there in our last one. So I'm excited to talk to Dr. Zamora on this one. And she's a doctor of chiropractic medicine, as I hinted at there before. She's been in practice in North Phoenix at the same location there for 14 years at Imagine Wellness Chiropractic. Dr. Zamora provides chiropractic corrective care and car accident care for all ages. Dr. Roxane, welcome back.
Thank you. Happy to be here.
I'm excited to dive into this one. How is allergy health? We'll kind of do like a little intro recap from last one. That's been heavy on the radar here at our store as well in clinic. Have you been seeing a lot of patients here the last couple of weeks with allergies?
A lot. And I have a technique that helps like drain the sinuses for people because it's so windy that it's making it really bad. And this chart behind me, whenever the bone is out in the neck, it causes allergies. So, and if anybody wants a copy of this, I could send them if they email me. But it looks like the headaches, migraines, dizziness, sinus problems, and allergies is the number 4 symptom. Because what happens if you lose the curve in your neck, then the first bone, which is your atlas, rocks up and it pulls the brainstem down. And then it causes problems for eyes, your nose, your ears, and then also headaches and dizziness and allergies. So yeah, I've seen a lot of people that have been coming in for headaches, also that are induced by allergies or dizziness. A lot of times dizziness can be from allergies as well as, and the atlas, the first bone shifting. So that's why I always take x-rays, look at the position of the atlas. It should be at 31 degrees. I measure that, and then how do we get your body into a better space?
So, folks, I know a lot of people that shop at our store that see chiropractors, that see naturopaths. They're not wanting to only rely on Benadryl and Claritin and all these different over-the-counter for allergies. So that's not, a lot of people don't know that, Dr. Zamora, that chiropractic care could be a tool that you can add into your anti-allergy arsenal, especially with seasonal allergies. So let's talk a little bit more about that. Is it right there at the top of that spinal cord, these nerves start coming out, correct? Let's really simplify
Absolutely.
it. And then that's going to feed directly your sinuses and ability to fight all these different bugs in the environment and all that. Is that a good way to look at it? Explain that.
Yeah. Because every time you get adjusted, it also boosts your immune 200%. So when I have a lot of patients who people around them are getting sick, they're either not getting, sick, or if they do have like a health issue, they heal and repair a lot quicker. So when you boost your immune, it helps the allergies as well. It helps the histamine levels in your body so that your body can overcome that. And another thing I recommend people check their adrenals, because if your adrenals are really low, then it's going to cause allergies as well. And a good test for that is if you find where your ribs meet here, like this area, if you feel in there and it feels tender, your adrenals need some help. And that will help with allergies as well as getting your atlas corrected and taking Drenamin.
So then let's quickly do a recap on Drenamin. Why are you a fan of that product? How many years, when did it hit your radar? How long
Oh,
have you been using that clinically?
I love Drenamin. I took it personally forever. I practiced in Illinois before here, and you know, when the allergies hit in Illinois, it doesn't play. I mean, you're going to have it bad. So
Right.
I started taking Drenamin myself. And then when I came out here, I had so many patients experiencing allergies because we have blooms all year long. So it's even more profound here. So I started incorporating Drenamin into my practice here. When I first started, I only adjusted people. I didn't consider supplements at all. But our food is so deficient
Right.
that, we really need supplements to help our body heal and repair. So I started incorporating it. And that was one of the first ones that I started incorporating, is because people had allergies year round here. So I love it. I love it personally. It works for pets. I give it to my dogs. Sometimes dogs can get those teary eyes.
Oh, yeah.
So when my dog gets that, I will give her Drenamin as well. And it's safe for all ages. Like, I have kids who take it. Like, you can crush it
Oh,
up
okay.
and take it in their food as well.
It's always a thing if kids are going to take it or not. It's always something. It's a
Yeah,
roadblock, right? So if you can get that in them,
yeah,
that's perfect.
yeah,
So good. That's a good little recap on allergies, chiropractic care. You explained the atlas,
yeah,
how this is all involved, and even including the adrenals, and then Drenamin was a good recap on standard
yeah,
process that product offered there. I want to switch gears and hit on migraines here, Dr. Zamora. We've
yeah,
been having a lot of patients that it's a common naturopathic patient is to seek out care from us for migraines. Let me hear your thoughts on this, and we can even go deeper from there. But I want to introduce that. What's your experience and thoughts on this issue with migraines?
yeah. So I don't know if you could see this behind me, how clear it is or
Yeah.
blurry, but here's a normal neck,
Oh, it's
this
perfect.
nice curve from the side, and the atlas at 31 degrees. But when the curve goes straight, then the atlas pulls up and it literally pulls the brainstem down. And then it's putting pressure on the brainstem. It's like on a sympathetic overload. That's why it can also be connected to ADD, depression, anxiety, as well as headaches, because it's putting a constant pressure on the brainstem. So I always want to measure how close to normal are they, or here to subluxation. And what subluxation is a dislocation is the bone is out of the joint, right? A subluxation is less than a dislocation, but what it is curve goes straight, degenerative disc builds up, arthritis builds up, and then it starts causing the vertebral subluxation complex. So I look, where is this? Where is their spine subluxated? What phase of degeneration? Because there's 3 phases of degeneration. So I look at that and I say, all right, where's the atlas? How do we get it to come back down? By restoring the integrity of the curve. So then the brainstem can go back up.
Wow.
Yeah,
That's incredible. You see this explosion since cell phones came out and especially smartphones. Like the initial
yeah,
iPhone was just for music. It wasn't that bad,
yeah,
Then the apps
yeah,
started coming out. So then now you have this posture in high
yes,
school kids, and you see an
yeah,
explosion in mental health issues and migraines and anxiety, depression since
yeah,
smartphones came out. So
yes,
what do you tell parents and kids that come to see you who I'm sure you've taught them about posture, correct? Let's hear your thoughts.
yeah. So, clinically it's called forward head posture, but now everybody knows it as text neck, right?
Yeah.
Because of this pulling forward. And so what happens also, the problem with that pulling forward, not only is it causing problems with the brain, because 90% of the stimulation to the brain is from the movement of the spine. So if the spine isn't functioning, your brain is not functioning as well. I mean, if 90% of the brain is health is from the spine, you have to get the spine moving. And what happens with text neck is the head goes forward, right? We're used to this looking down or in the computer. So the neck goes forward. Well, that also then starts putting pressure on the heart, the nerves that go to the heart and lungs. And again, if you look up here, that goes to neck, shoulders, elbows, wrists, hands, fingers, heart, and lungs. So that's the disconcerting part about it. It's not just that it doesn't,
Right.
you know, you don't feel good when you see a glimpse of yourself. And trust me, I work on this. I get adjusted myself once a week, and I have to do my therapies. When you get a glimpse of yourself and you see that, not only does it look unappealing to you, you're like, but it's also causing problems with your heart, your lungs, numbness and tingling, and also the brain health. So you really want to see where is your curve, get it into a better position so that the brain and the body can heal overall.
Yeah. Or even practice extension exercises, would you say?
Yeah.
What are some at-home exercises to kind of cancel out?
This is a good one for sure, where you're stretching and then you're pushing against your hand, right? So my head is going this way while my hand is going this way. So you're at some resistance here. We also provide therapies for patients to take home, but you can also get a pool noodle, right? Get a pool noodle, put it behind your neck, and then do this. Start with 2 minutes and do that every day until you get up to 15 minutes a day, or at least 3 times a week. And if the pool noodle is not firm enough, you can add a towel around it to make it thicker so that you can get this extension, because that's what we want, right? Is this curve and an extension.
Right.
So that's a quick and cheap way to start working on it.
I love it. That's free. That's inside tricks from the, you know, this is high level stuff, folks. I wonder how many people are actually going to apply this information, Dr. Zamora.
Yeah, go to the dollar store and get a pool noodle.
What do they say? You can lead a horse to water, you can't make them drink, right? You know, let's see. If you folks do these tips, comment below, give us a like, let us know what you notice.
Yeah.
I'm doing this. I'm practicing the other way instead of just that forward flexion all day. Yeah. What is the head weigh, Dr. Zamora? I heard it's like a bowling ball. Is this true? The weight of the head?
The head weighs 10 to 15 pounds.
That's unbelievable.
And so when it goes forward, I'm going to move this. I don't know if this is too distracting or not, but
no, it's perfect.
This is forward head posture, but let me see. So you see that when that goes forward, it starts adding weight.
Oh my goodness.
So it ends up being like a 30-pound weight instead of a 10 to 12 pounds. And so because of that, the curve, your neck going forward, and because it's putting pressure on the heart and lungs, the body's so smart that the shoulders will round, because it's trying to take off some of that, because it knows you need your heart and lungs to breathe and live, right? So the shoulders go forward. Well, then what happens with that is then you have this tremendous amount of weight. So it's like 32 pounds. And so then what happens is the pelvis rocks forward, because now it's trying to help this whole situation here. So now this goes forward, shoulders go forward, and then the pelvis rocks forward. So our goal is to get this curve back, get the shoulders back, and get everything in one plane line.
How about maybe laying on the floor too when you come home from work for a couple minutes? Just lay on that to kind of cancel out. Is that something you've ever used? Wait 1 second. There it is. Yeah. Can you hear me now?
Yes.
I was saying if someone can lay down flat on the floor after coming home from work or being on the desk all day to kind of level out that gravity force.
Yeah.
That's a good strategy too? Perfect. So really actionable tips, folks. Episode number 124. We're talking here with Dr. Roxane Zamora, who's up in North Phoenix at Integrative. Remind me the name there of the clinic, Dr. Zamora. We have Imagine Wellness Chiropractic. There we go. Imagine Wellness Chiropractic, North Phoenix. Same location for 14 years. You can even head over to imaginewellnesschiropractic.com. imaginewellnesschiropractic.com. I wanted to hear, so we've covered migraines, allergies, getting that posture figured out. So one thing I want to figure that I've been watching some videos of chiropractic care, like actual techniques. What's one of your favorite? I've heard chiropractors have their favorites that they like to perform. What's one of your favorite moves or corrections that you like to do?
Well, I love to see how it all works together, right? Everybody's has a little bit different. I have a lot of different
Right.
techniques. Um, I like the Y traction, which people have probably seen where it goes under your head and you pull it. Um, when I see some people doing it on YouTube, it's horrifying
You
because it's
cringe?
not how it was intended. Yeah, it's like, oh,
Oh my goodness.
but it's really should be a gentle process, but effective. So, I mean, that one is really effective and I love it. And I do manual adjustment. So I also use the drop table and I have an activator and an artho stim. So I don't know if I have a favorite, although at the end, what my favorite is of their care plan is I take post x-rays. So we can compare your pre x-ray to your post x-ray. And really that's my favorite because people feel different and they know they feel different. And then when you get to see your post x-rays, because you really can see the integrity of the spine return. If the disc was degenerating, you can start to see the disc healing and repairing and pumping back up. And you can see arthritic spurs stop to grow. You can see where they're no longer almost fusing. So I would say really all of the adjustment techniques are my favorite, but
Right.
my favorite is post x-ray review with patients when we get to see the pre and post.
The before and
That's
after.
really,
Yeah.
yeah.
To confirm
Before.
what they're feeling, really. So it's
Yeah.
not just like when they say the placebo effect,
Yes. Yeah.
right?
They literally get to see it. It's so exciting. It's my favorite.
You mentioned the Activator tool. We've never really dived deep into that. What is that exactly? How does that work? Tell us about the Activator tool. Not many people would know what this is unless they've had
Yeah.
chiropractic care. But
It's a handheld instrument. This is not it, but it's about this big. And you can calibrate it for up to 3.5 pounds of pressure, which you
oh
would use
wow,
for the low back and the hips, or you can lighten it up for the neck.
interesting.
And I use it also to break up some like old adhesions and trigger points so that we can get the spine to move more. But it's very effective. I had a NFL player and he really did not want to hear any popping or cracking sounds. And so he only wanted the activator. And I mean, this is a big guy. Like he's a big NFL player. And he only wanted the activator. And after about 2 weeks, he's like, you know what? It's the first time because he was like, is this going to do anything? I was like, yes, it is. And after about 2 weeks, he's like, man, it's the first time I can bend down and tie my shoes. So it looks tiny, but it has amazing effects. It is a very effective technique.
Yeah, here's an example of an
There you go.
activator. It's just kind of a rough. This may or may not
Yeah.
be the exact one you have, but just to kind of put
Yeah.
it in perspective, what we're talking about, so you can even do it there on the
Yeah.
cervical area down here on the neck.
Yeah.
Correct, Doc? So you
Yep.
would just lighten up the
Yep.
pressure. That's really interesting.
Yeah.
So what ended up happening with that athlete? Was he happy in the end?
He was really
Yeah.
happy. And you know what? It was so interesting. He had asked me, this was a ways back, he had asked me to write a letter because this was before, concussion. Before we knew a lot about it. But he said, you know what, I think these concussions are causing me problems. And I said, I'm sure of that. Because
Yeah.
you can only concuss the brain so much. And it doesn't take a lot to concuss the brain. That's why if people are in an accident, I say come in because the hospital isn't going to check for concussion. I will check for a TBI, which is traumatic brain injury or a concussion. So he had asked me to write a letter to the commissioner. And I thought, well, I'll do it. The
Wow.
commissioner's I listened to some chiropractor in Phoenix, but I still wrote it. And,
Yeah.
you know, and again, who knows what happened, but eventually that that player, he said, I don't want to do it because he was younger. He had a family, his wife and kids. And he's like, it's causing me problems. And no matter what they say, I know it is. And so eventually he quit, started a nonprofit for
Amazing.
kids to play sports. So I'm proud of him, but he had great success with it. And that's a sidebar. If you're in an accident, please
Right.
come get tested for your concussion or brain injury, because it's happens more than people think it does, and can have lifelong chronic conditions from it.
Right. And as I mentioned there in the introduction here, you work with car accident care for all ages as well. What's the
Yeah.
most common issue you see there? Is it the whiplash? Is it low back? What are the most common complications from a car accident? So this can help people be extra careful when they're listening to this. You don't want to end up in this situation, right? What would be some
Yeah.
of the most common issues following car accidents?
Definitely a traumatic brain injury. People
Oh,
think they
wow.
have to get knocked out, for them to have a concussion, and it's not true. It doesn't take a lot to concuss the brain in the skull. And so then they start having fuzzy focus, or the light starts to irritate them, or their family starts to irritate them when they're not typically like that. It really does start to cause changes in people's mood. And then headaches start happening. And then that can last forever. And you would not believe how many people come in here and they're like, I had somebody this morning, a new patient, say I was in an accident in 2022 and I've been having these problems since. And I don't know if that's from that. And I'm like, it is. People have no idea that, but they'll say, I think this happened after I had an accident
Yeah.
4 years ago and now it's chronic. And I'm like, yes, that's why I really
Wow.
genuinely say, please get checked, even if the hospital says no, because you want to avoid lifelong chronic conditions of headaches, again, anxiety, depression from the brain being concussed and not healed and repaired. And so we also give patients a handout on brain management and supplements to take to help the brain heal as well.
Very important information, Doc. Thank you. And
Mhm.
what about motorcycle accidents? You know, that's extremely dangerous. What have you seen motorcycle drivers over the years?
I have, and they'll usually end up with shoulder injuries, or like their elbow or hands or legs. A lot of extremities. So those are what we call extremities. So a lot of extremity injuries for people on a motorcycle. It's horrifying.
Yeah. Okay, we'll wrap up. I want to do one more supplement. We mentioned Drenamin from Standard Process, which we have right here at Healthy Habit Health Foods. If you're already shopping right now in the store and you're listening to Doc and I talk, we have that right here in stock. If not, we can special order it for you through Standard Process. What about just for pain in general that you, not necessarily allergies, but is there any supplements that you like using over the last 5-10 years for
Yeah,
inflammation, be it vitamin C or turmeric? What are your thoughts on that one?
I love turmeric. I love it. Also, if people are there getting their Drenamin, grab Ligaplex from
Okay.
Standard Process as well. Ligaplex is very healing. It helps ligaments, joints, muscle. It will bring down inflammation and start calming the muscle and healing and repairing it. So Ligaplex 1 or 2 is wonderful. So
Perfect. It's always good
yeah,
to, one or two that will cover multiple bases. That makes a lot of
yeah.
sense, especially if you had, a recent car accident. Maybe you're not ready to make that commitment to chiropractic or you want to just still get more information. You can at least start by taking over the counter such as these ones. Well, over the counter, since we have the practitioners here at the store that can help you get set up with these. So what's a good recap then, Doc, for today? We hit on a lot of different things. What do you want to leave our listeners with? This is our fourth episode of 2024 here, and hopefully we'll be able to get you on again soon. But what's a good take home after 4 times people listening to you today? What do you want to leave us with here for 2024, Doc?
That chiropractic isn't just about pain relief. It's about overall wellness, because every bone controls a nerve, every nerve controls an organ, and a feather's weight of pressure on a nerve decreases the function of that organ by 50%. That's the big message I really want people to get. Get your x-rays, see the health or degeneration of the spine, and then come up with a plan where we can correct it. And then look for overall wellness, just not pain relief. Although I want to get you out of pain, but my bigger picture is I want you to be healthy, because we're part of a community, right? Our health is important to other people, our coworkers, our family, our loved ones, and our fur babies. So you want to take care of yourself, and a lot of times we are the last to take care of ourselves. Consider
Right.
chiropractic for overall wellness.
Amazing, Doc. Let me see here. And what would you leave if we have a student? We'll finish the last minute like this. A student that's finishing high school or they're going to college. They might be interested in a career in chiropractic. When they were younger, a chiro helped them to be better at basketball, let's say, or another sport,
Yeah.
or after their car accident. After 14 plus years being in the field here, what would you leave our future upcoming chiropractors? Would you say you love the field? It's a good idea?
I love it. It's so rewarding. I mean, when you see a baby get adjusted, who was scheduled to have an operation 2 months down the road and they no longer need it, it's the most rewarding. At a baby who was failure to thrive after their second adjustment, their MD was like, I don't know what's happening, but it's like a miracle. So if you're considering chiropractic, do it. It's the most rewarding job I could ever think of.
Thank you so much, Doc, for your time. I really appreciate you, and I loved our conversations these last four. So we're gonna have you on again soon, and have a great rest of your week.
Thanks, Doc.